So these are very, very relevant, Dr. Srinidhi, because these three things which we have covered, whether it is thalassemia or a sickle cell disease or leukemia, or if I add aplastic anemia, they actually form almost 90% of our practice. Okay, so bleeding disorders and these four or five, they form 90% of our practice. Okay, so talking about first of all, thalassemia and sickle cell disease. Okay, so I think all of us are familiar with thalassemia, but lesser number of people know about sickle cell disease. Okay, we consider them to be sister and brother diseases. Okay. So if we put these two together, they are the largest red cell disorders across the globe. We are more familiar with thalassemia, but sickle cell disease has a larger, even a larger burden, more burden of a disease across the globe. And even in our country, almost 2 to 3 times the number of kids born with thalassemia are born with sickle cell disease. Both of them are form a significant health challenge for our country. Now, what happens in these two? Thalassemia, as we all know, the red cells are defective. So, in thalassemia, they are not optimally, they are not functionally optimal. Okay, so that's why a lot of these red cells they tend to break down early. Ideal lifespan of a red cell is say 100 days, 120 days, but in thalassemia they tend to break down early, and that's why these kids require regular transfusion. It might be at an interval of 6 weeks, 8 weeks to start with, but as they grow, the interval starts decreasing. So they need blood transfusion more frequently. And with every unit of blood which they receive a lot of iron inside the body. So at some point of time, they need chelation. So this is one aspect of management of thalassemia. Sickle cell disease, as the name suggests. So sickle is in Hindi we call it as hasya. Hasya. Okay. So which is curvaceous in shape. Okay. Or some people say moon shape. Now, what happens in sickle cell disease is that the red cell, which should ideally be biconcave, with very smooth margins, so that it can travel inside the blood vessels without causing damage to the blood vessels. Because of sickle cell disease, rather than these being smooth margins, the margins or the ends become pointed. So whenever this sickle cell moves inside the blood vessel, every time these pointed ends cause damage to the blood vessel. Okay, and as it is traveling, as it is moving everywhere in the body, whether it is brain, whether it is eyes, lungs, kidney, heart, everywhere, they have capability of damaging every part of the body. Now it's a very variable spectrum. Some kids might just have CNS manifestations. Some might just have uh, 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 lung manifestations. Some might just have painful crisis. So it's a very very variable manifestation. So, but believe me, both of them are pathetic. Okay, it disturbs the quality of life of not only the child but of the entire family. So, one way of treating them is providing supportive care, and the other way is just to cure these diseases completely. As of today, the only curative option for these two diseases is by offering a bone marrow transplant. Okay? And once the transplant is successful, then these kids are as good as any other normal child and they're cured for life. Coming to the third disease which you talked about, which is leukemia. Leukemia, in plain and simple words, easy to understand, is a blood cancer. Okay, so leukemia is blood cancer. It has it is of various subtypes. The commonest in pediatric age group is ALL, whereas in adults it is AML. Okay. Now here what happens is that the blood cells starts performing weird. They start forming abnormal cells. Okay, which are cancerous in nature. Okay, so these cells need to be addressed, and how they are addressed? They are addressed by giving chemotherapy. All right. One line which I would like to say here, well, it's a very big topic to cover, but the message which I want to convey is that leukemia is a success story, a real success story in chemotherapy or oncology world, especially the pediatric leukemia. 30 years back, 3 or 4 decades back, the outcome was 10%, 20%. And in today's day and age, the outcome of pediatric leukemias, if we treat them nicely, aggressively, is more than 90%. And we are not talking about 2 year or 5 year survival. We are talking about lifelong survival. Okay. So whenever a child is suffering from leukemia, please don't get lured by this diagnosis that this is something which is not treatable. In today's day and age, if we treat it in a disciplined manner, it is very, very, very nicely treatable with excellent outcomes. Fourth disease, severe aplastic anemia. Again, the same story. Very common disease in this part of the world, but disease which needs immediate intervention, and the only and the best treatment for pediatric age group is transplant, with outcomes as good as 80 to 90% if the child can receive this treatment within 3 months of diagnosis.